Do not wait to get screened. If it's your time to get screened, just go. Go and get it done because it could save your life.
I screened for cancer because there is a very strong family history. My brother, who is 9 years older than I am, was diagnosed with colorectal cancer.
I believe people are afraid of getting screened and can be reluctant to do it because, well, it's logical. We're all afraid of someone telling us that we have cancer.
In Ontario, we have organized cancer screening programs for cervical cancer, colon cancer, and breast cancer. All women who are 21 years of age or older are eligible for a Pap test if they have ever been sexually active. If that test isn't normal, it does not mean that you have cervical cancer. What it does mean is that some type of follow-up is required. The procedure itself is quite simple. Essentially, what it involves is lying on an examining table. A speculum is gently inserted into the vagina in order to be able to take a sample of cells. With regular screening, if you follow up on abnormal results, cervical cancer is almost entirely preventable.
I was diagnosed through mammogram, had a biopsy, and then I was diagnosed with the stage 1 breast cancer.
A mammogram involves a low-dose X-ray that's taken 2 pictures specifically for each breast.
I'm adopted. My birth mother and her mother had both had breast cancer. We didn't have that time. I would have liked to kind of get to know her as an individual. Unfortunately, I only knew her as sick. I spend a lot of time with my kids because life is so short. What I'm doing now is taking steps in my career as well as my life so that I can spend more time with them.
The stool test is for men and women who do not have a family history of colon cancer or any symptoms suspicious for colon cancer. The test involves collecting small samples of stool in the privacy of your own home and tests for traces of blood. You can get the test from your health care provider. Once you've completed the kit, you mail it to the lab in a prepaid envelope. For men and women, though, who may be at a higher risk of developing colon cancer, the recommendations in Ontario are different. If you have a first-degree family member who's been diagnosed with colon cancer, if you have a mother, father, sister, brother who's been diagnosed with colon cancer, the recommendation is that by the age of 50, you undergo a screening colonoscopy. A colonoscopy requires, first of all, some preparation.
You go to the pharmacist and you get these little packets that you drink over the days preceding that clean out your system.
It involves using a tube with a camera and a light that's inserted into the rectum. And if there are any areas of concern, tissues can be sampled at the time of the colonoscopy.
It's quite a non-invasive process. What would the alternative have been? Not spending the rest of my life with my children and meeting my grandchildren one day and living a long and happy and healthy life.
I take it back to my brother's words. You have to get in and get screened. You have to. Because if you get the clean bill of health, yeah, okay, that's the best thing. If you don't get the clean bill of health, you've caught it as early as you possibly can.